Hi, this is Emily Brandt, an MSN student at Wilson College, and this is my presentation on simulation learning in nursing and the impact it has on clinical education. Some learning objectives I hope to meet with my presentation are to describe simulation learning and its related terms, examine the ways simulation can be used in nursing education, understand the need for simulation learning in current nursing curriculum, interpret research findings about patient simulation outcomes, identify how simulation can be used to enhance cultural competency, and to list the advantages and disadvantages of simulation education for instructors and students. So what is simulation learning? The text defines simulation as the creation of a representation or model of a real-life situation. There are some terms related to simulation. One of them is fidelity, which is a continuum of simulation realness. On the low end of the fidelity spectrum are simulations with low-level realism, but concepts can still be learned. Examples are case studies, partial task trainers, such as medical representatives bringing in equipment for nurses to practice on, and static mannequins, such as this arm for IV insertion training. Medium fidelity simulations are technically sophisticated with two-dimensional focus capabilities. Examples are mannequins with heart and lung sounds, but do not include chest rise, or lack some element of real life. High fidelity scenarios are extremely realistic and interactive. Examples could be standardized patients, which are people who are given symptoms to portray and a script to follow to interact with students in a controlled environment. Virtual reality and full-scale simulators, such as this iStan, which is a very high-tech patient simulator. Other terms related to simulations are partial and full context simulations. This is related to but differs from fidelity. Partial task trainers can be a part of a body that's used for students to practice a specific psychomotor skill. Examples of this would be IV insertion, NG tube insertion, and Foley placement. This is versus full context simulators, which utilize full context scenarios to mimic reality. And to demonstrate how fidelity and context are similar but different, I have here that whole mannequins can be a full context simulation, but only medium fidelity. And also full context case studies can be used, but still be a low fidelity simulation. Full context, high fidelity simulations are extremely beneficial to the nursing student, and some would say they're the most beneficial in clinical education. Ways simulation is used in clinical education. The National Council of State Boards of Nursing allows 50% of undergraduate nurse clinical experience to be via simulation. Ways simulation is used in nursing education is through role-playing, standardized patients, computerized mannequins, and practicing with tester equipment. The theoretical basis of simulation learning, it was created and utilized and still is today out of necessity. In the late 1990s, portable, versatile, and affordable high-fidelity patient simulation began to be used, and it was used for teaching, evaluating, team skill building, and clinical substitution. Now, this is pertaining to high-fidelity simulations. It should be noted that low-fidelity simulations such as case studies have been used in nursing education for decades. Some of the reasons simulation learning has become a necessity is because of the complexities in healthcare, changing patient populations, limited clinical settings, which is directly related to the focus of outpatient care nowadays, and the transition to primary prevention. Advantages in technology have also made simulation learning very popular with nursing education. Other reasons for simulation learning are shorter hospital stays due to the outpatient focus and faculty shortages. From evidence of simulation learning's impact on nursing students, I found two studies of which I included in my presentation. This slide is about the study by Norman in 2012. It was a systematic literature review of 17 studies regarding simulation outcome measurement and nursing education. The study actually started off with numerous research articles found in databases, but was eventually diminished down to 17 studies for outcome review. Three outcome categories were established, which were internal, external, and clinical evaluation. The internal outcomes that were defined by the researcher were dependent on the learner's perception. These internal outcomes were clinical judgment, satisfaction, and self-confidence. Two studies that were reviewed showed increased confidence in post-op and postpartum clinical situations after simulation learning was conducted. Overall, the study findings suggest that simulation-based learning can lead to improved internal outcomes. External outcomes were defined in this study as factors that are learned. The majority of the studies reviewed state that controlled environment does help student communication and safety. Three external outcomes are knowledge and skills, safety, and communication. The study findings suggest that the simulation contributes to improved knowledge and skill acquisition, communication, and safety, and is beneficial when used to augment the clinical practicum. The researcher had some difficulties when determining clinical evaluation in relationship to simulation. No study specifically compared the students' performance in simulation versus the clinical area. Most of the students in the studies were evaluated based upon oral evaluations, grading rubrics, and structured clinicals, but not how their simulation experience translated to clinical practice. So, in summary, Norman concluded that simulation in nursing education is beneficial, but there is not sufficient evidence to determine how this type of education transitions into nursing practice. The next research study is by Radford. It's a study of a rural nursing program in Tennessee. 90 students were selected and they were administered a satisfaction and confidence survey following a simulation experience. There were 5 questions pertaining to satisfaction, which included things like, were the teaching methods in simulations helpful? Were they provided with resources? Did the instructor utilize a simulation correctly? And the average overall student score out of 5 was 4.63 for that. There were 8 questions that pertained to self-confidence in learning on the survey, some of which included students' confidence in mastering simulated contexts and knowing their responsibilities in simulated situations. The overall satisfaction score was 4.50. So Radford concluded that the use of simulation in rural nursing programs can help offset the challenges that students in these geographical areas face, such as limited clinical sites, and in addition, it offers a safe environment for nurses to practice clinical judgment. And this study is beneficial, however, it is a small, biased study that produces a generalization of all rural nursing programs. And I'm not quite sure how much the questions posed have to do with their conclusion. However, it's still a helpful study in showing how rural nursing can benefit from simulation learning. When speaking of multicultural aspects in simulation learning, there really is little to no research pertaining to multicultural students in simulation learning. However, I was able to find that companies do offer an array of skin colors and language choices for mannequins, such as this image here from Laerdal Medical, showing different skin tone options for mannequins. I was able to find 2 studies which involve simulation learning and cultural competency. One by Garrido and Associates was a study that was performed in which students simulated scenarios depicting many cultures to ensure cultural competency. This study was very beneficial and very vast and encompassing. It was precepted by foreign educated physicians with multicultural backgrounds. They actually utilized real rosary beads, voodoo dolls, holy water, chamomile, and cod liver oil and other religious items to help make the simulation seem more real. In total, there were 11 different simulations depicted, which included many religions and sexual preferences. A study completed by Seckman and Diesel recommended that all aspects of nursing education include diverse healthcare beliefs, practices, and values. They also note that nursing is a practice based profession and encourage simulation to be used frequently to immerse students into culturally sensitive situations. There was a lot of information in this article about the importance of immersion through simulation in cultural competency. Some simulation learning advantages for instructors are active involvement in students' learning, more effective use of faculty in the teaching of clinical skills because they can be there one on one with all the students, and errors can be discussed immediately and prevented for future occurrence. Some disadvantages to simulation learning for instructors is that it includes a large burden of knowledge and expertise because the instructors have to learn how to use the mannequins correctly. They also must set aside adequate time for the simulations, and it can be complicated for instructors to quantify and document clinical hours for students to meet licensing requirements. And is an educator facilitated learning style, which may be different to some educators. Some advantages for students are it builds strong student nurse confidence, decreases anxiety for clinical situations by being able to practice them in not stress-free environments, allows students to fail safely by being able to learn through trial and error in a safe environment, and encourages student communication with other students and with the instructor. The disadvantages for simulation learning for students were hard to find, so I came up with the anxiety of performing in front of peers, which was an issue for me whenever I was in school, and students can get used to simplified or ideal patient conditions and make it difficult when practicing on a real human. In conclusion, simulation learning has been approved for use in nursing education. It is a vital tool with many advantages and disadvantages and will probably be used for years to come. Here are my references. Thank you for listening. I hope you learned something about simulation learning in nursing education.